Medical debt is a growing crisis in the United States, and the situation is especially dire in Louisiana. Across the state, consumers owe nearly $2 billion in medical expenses. A New York-based nonprofit has stepped in to help alleviate some of that burden for patients across Louisiana. I am joined by Allison Sesso, President and CEO of Undue Medical Debt. Allison, thank you so much for joining us here remotely, but here at LPB in our studios. Medical debt in Louisiana, it's a pressing problem with consumers here, and Undue Medical Debt stepped in to be part of the solution. Now, before we begin talking about that solution, tell me about Undue Medical Debt. What is the organization and its mission?
Yeah, so we are a national nonprofit organization that is working across the country to undo medical debt. That's in our name. What we mean by that is we both want to get rid of medical debts that people are confronting, and I could talk a little bit about our unique model, and it's very one of a kind, and it's being used across the country, as I mentioned. But we also fundamentally think that the issue of medical debt should be solved in a bigger way and with broader solutions. So we're also leaning into the idea of supporting policy changes that can get ahead of this problem and help people so that, frankly, our work isn't needed in the first place. There's a for-profit market for medical debt that we take advantage of in terms of the pricing. So we take government funds, we take donated dollars, and we use those to buy medical debt directly from providers and from the secondary market. And it's literally $1 gets rid of $100 of medical debt. So we use that, and we've been able to get rid of $13 billion of medical debt across the country using this model. And you don't apply. We literally go to the market, we buy the debt, and then we send people letters and say, you've been freed and cleared of this medical debt.
Tell me about the work here in Louisiana. You worked with Ochsner Health to buy medical debt here to help out Louisiana consumers.
Yeah, so I have to say, Ochsner was a fantastic partner. They're a fantastic provider. They've really thought long and hard about this issue of medical debt, and it's one that falls in their lap. And unfortunately, in our country, many people are underinsured, and they have deductibles that they just can't meet.
How much medical debt did you buy, and how did that translate in terms of the number of Louisiana consumers that received the debt forgiveness?
So the total that we bought was $366 million, helping 193,000 people. That is a combination of people largely in Louisiana, but also in Mississippi and Alabama as well. And what the impetus for this buy was because of an investment that New Orleans made. And there we were able to help 66,000 people and get rid of $59 million in debt just for people in New Orleans.
All right, I want to talk for a minute about what medical debt does to the consumer and their credit.
Yeah, so I mean, medical debt is really it's the number one form of bankruptcy in the country, and so it obviously is a huge problem. It's very, very common, unfortunately, and it does impact people's credit. Although I will say, not always. It really depends on the hospital, and my understanding is that Ochsner actually does not tend to make this a credit issue. It still does prevent people from going and getting the care that they need, and it does overwhelm people and give them sort of bad feelings about going to the doctor. But in general, credit impact can be significant, and when we relieve these debts, if there was an impact on the credit, it is removed.
Have you been able to kind of survey and get a sense of how widespread medical debt is here in the state of Louisiana? I know you're working with Ochsner, but have you been able to get kind of a scope on the problem statewide?
So we did look up some numbers in preparation for this conversation, actually, and we do understand that there's about $1.94 billion in Louisiana of medical debt. So it's obviously pretty significant. I will say that Louisiana is not doing so great in terms of collections. There's 22% of people in Louisiana do have medical debt in collections, and that's the third highest in the country in terms of states.
This is one solution, one approach, right? But at the policy level, what does Undue Medical Debt want to see happen to further get control of medical debt, not only in Louisiana, but nationwide?
Yeah, so there's a couple of solutions. Number one, I think people need to be better insured. So if there hasn't been the uptake of Obamacare or the ACA, as it's also known, we need to ensure that people get better insurance by ensuring that the state is taking that expansion. And a lot of states haven't done that yet. So making sure that we have good subsidies for insurance. So when people walk in the door of the hospital, they have better, more robust insurance that doesn't have a lot of loopholes, either because of deductibles or other out-of-pocket costs. So that's number one. And we need to build off of that. Number two, when somebody does have a bad insurance or not fully coverage when they walk in the door, it's important that the hospital have robust financial assistance policies, also known as charity care, in place, where there's either a free care given to the individual or discounted care. And then lastly, if you do end up in medical debt, let's make sure people don't lose their homes, have their wages garnished. Those are called extraordinary collections actions. Let's make sure that those things don't happen to individuals, because it's not their fault that they ended up in medical debt. They simply got sick. In fact, the number one predictor of whether or not you're in medical debt is not related to your insurance status. It's related to whether or not you suffer an illness.
Allison Sesso, thank you so much for joining us. I'm sure there are hundreds, if not thousands, of Louisiana consumers very grateful for the work you're doing and continue to do.